The shorter, colder days of December can be difficult for people struggling with their mental health. It's a time when feelings of sadness or depression could be intensified. Prosser Memorial Health is raising awareness of the issue, and I spoke with a psychiatric nurse practitioner about what to do if you're feeling low during this season. A gloomy winter day can have a big impact on your mood.
It gets darker much earlier, it stays darker longer, and so the brain doesn't have that much exposure to the light, and it just starts, we don't get enough serotonin, they believe, that's produced, or less serotonin at that time of the year.
And for those who are already struggling with anxiety, depression, or bipolar disorder, their symptoms can be intensified.
They'll have feelings of sadness, maybe even feelings of hopelessness. Sometimes the people either feel like they want to sleep more, and sometimes they feel like they want to sleep less. People can find that they have changes of appetite. If it gets really severe, sometimes people can have thoughts of suicide or self-harm.
These are indicators that you should see a doctor or mental health professional, or call the Suicide and Crisis Lifeline at 988. But psychiatric nurse practitioner Heather Morse says there are some preventative actions you can take before you reach this point.
I think some things that you can do to protect yourself from that is continue being social, continue doing healthy daily activities, make sure you're eating well, make sure you have a good sleep routine and are sleeping well, make sure you exercise. Exercise, I feel, is so important.
And when there is a sunny winter day, get outside and soak it in.
Being outside in light exposure can be very important in decreasing the symptoms.
Morse says people living in eastern Washington are less likely than those on the west side to be affected by seasonal depression because of an increase in sun exposure. If you don't feel comfortable reaching out to a healthcare professional, Morse encourages you to speak to family or friends to get support. And again, the number to call if you are having thoughts of self-harm or suicide is 988.